I believe that we have a very broken, a fundamentally broken system that's completely inequitable in how it delivers care. I believe that we put way too much into this system and way too much gets eaten up through administrative and other costs. I believe that for-profit gatekeepers leads to the worst kind of rationing. And when people talk about rationing in other kinds of systems, nothing could be worse than a for-profit company deciding who does and doesn't get care based on their bottom line. I really appreciated the presenters today, and particularly when they talked about what they thought was the common features between the highest functioning healthcare systems in the world. And I just want to call a few of those out as the values that I'd like us to bring forward. First of all, that universal coverage is an entitlement and a right, and that every single person has to be enrolled, not just because it's moral, but also for the very health of the system. Because when you take the healthy population out of your system, your system can't function. That the expectation of government role in oversight and regulation and setting standards is fundamental to any system. It can't just be what companies want to do. We have to have a commitment to equity, that it can't be that one group of people gets excellent medical care and everybody else gets just adequate care. Everybody should have the same level of care. And I loved the comment that in some countries, the doctors don't know who's been subsidized and who's not. They don't know who's walking in. They give everybody the same level of care. That should be fundamental to our values and what we want to present in California. And that we have to lower our administrative burden by having the simplest system that we can. We cannot have these different tracks, workers' comp, Medicare, Medicaid, and everything else. It needs to be simplified, and we need to take the administrative burden out, and also the burden that our medical providers are completely overwhelmed with when they have to deal with billing and provide care at the same time. Their focus should be on providing care. I happen to be a single-payer supporter. It was interesting to me to hear about other systems that are, kind of multi-payer but government-sponsored and nonprofit that function well. So I'm open to exploring those. I don't know what we can and can't do in California, but I think we have to absolutely have the will to try and to set an example for the rest of the country. And let's design a great system and dare the federal government to not approve it, and let the people rise up and say we demand our federal representatives to adopt what is clearly a better system.